Okay, so I actually want to talk about an advocacy win that probably a lot of people, it probably sped right by you. First of all, I just want to say I work with Access Lab, and I also work with another organization called First Domino Alliance. And what our two organizations do, we work to improve access to quality health care, particularly for people who are experiencing disabilities. And we do that by working to increase the amount of dignified representation of people with disabilities working in the professional capacity of the healthcare space. So I think that um, uh, the healthcare space has a long history of viewing people with disabilities as that a disability is a defect and not a difference. And I know that a lot of people have worked really hard to change that mindset. Um, so it's really important that other healthcare providers see people with disabilities in dignified health professions and understand that they can learn something from them, that people with disabilities are valuable and can do a great job in all kinds of areas. So anyway, so advocacy win. For those who, it sped right by you, ONC in the very recent past mandated that all certified electronic health records now have to be able to capture disability data about patients. That's a huge thing because if you don't get counted, you don't count, right? And again, that's a huge point in that it's not a defect, it's a difference. And a lot of healthcare spaces don't consider us as a demographic. So this is really important, and it's a huge win. It's not going to catch up to dental just quite yet because we do understand that a lot of dental health records are not certified, but we're hoping to change that. So dental teams routinely provide care to people with disabilities, and maybe they know it, and maybe they don't. And a lot of information needed to support that kind of care is like often a side note. It doesn't travel with the patient. It doesn't get asked. It doesn't get noted, so on and so forth. And especially it doesn't transfer to medical or dental to medical. So the new regulations really change that. So oftentimes what happens is a patient arrives and maybe if you're lucky, they have a dental passport that they can hand you that talks about the certain kinds of accommodations they might need. What ends up happening a lot is, there's less preparation than could have been done before. And so what happens is the scheduling gets behind, appointments run long, everybody gets grouchy, and the ability to capture this kind of information, ask once, note once, use always, is going to be really important to alleviate those kind of problems. So now that it's going to be mandated to be captured, that the electronic health records will have to capture it, it will help us create outcomes that are more predictable and stable. So that doesn't mean, and I have to add this with a caveat, it doesn't mean that it's mandated yet that providers will have to capture this. And again, there's a long road to go with dental, but there are huge benefits to dental to moving to certified health records. Um, yeah. So when this kind of information travels with the patient, it's much easier to prepare. You know what kind of time you're going to need for the appointment. You know if you should put it at the end of the day or the beginning of the day. You know that someone may need headphones and sunglasses for their appointment, or to dim the lights, or something like that. So it's much easier to prepare for that. Um, Again, yeah, functional needs are often stored in free text. Um, I covered that slide already. So again, there are several different workflow stages where this is going to improve the outcome for both the office and the patient. So scheduling, the setup, the chairside care, it's going to travel across providers. One of the things, if I just go back, that I didn't mention, and I'm not going to get into the weeds here, but because of the way that they have set it up, um, these these records are going to be standardized, and one of the things that's going to happen, and especially because of the CARES Act, if some of you didn't miss it, there's something called a no blocking rule now with the CARES Act. So for instance, if I'm CMS and I want to go in and check a certain provider to see if they are treating an adequate number of patients with disabilities, I can pull that provider's information under the new guidelines, and I can see how many patients with disabilities that they're treating. So, so this is going to be a huge thing for compliance, and it really will improve care for patients with disabilities. And why do I keep going? Okay. So universal design strengthens the system for everyone. So some of you have probably heard the term silver tsunami. When you are using practices that are beneficial for your whole community, you're automatically using practices that benefit patients with disabilities also. So what it looks like in real practice. Okay, example one. The needs don't come out until the visit, and the visit runs long and everybody gets grouchy. The day falls behind. If it's part of the record and the record travels with the patient, especially from the medical to the dental, because a lot of patients with disabilities, they're seeing a doctor, they're not necessarily seeing a dentist. So if the record travels with the patient, the scheduler sees what's going on, they know what to have ready, they know how to set it up, and the visit runs more smoothly. There's also more continuity across providers. Again, the information travels with the patient. And again, I can't stress that enough. We really need to encourage more providers to switch to certified records, because they are more integratable between medical and dental. And when that information travels with the patient, that's much better for everybody. Okay, so what we can do. For clinics and FQHCs, add structured disability-related fields to charting. Align scheduling blocks with those fields. Train staff, again, ask once, document once, use always. From the policy perspective, we are really encouraging folks to adopt certified dental EHRs that align with the USCDI disability data standards. Again, that's the ability to capture that information and share it bidirectionally. So if we are able to do this, It will improve patient confidence and the provider's confidence. When you know what to expect and how to prepare, it reduces everyone's anxiety. It will improve provider stability when appointments don't run long, when there's less drama, for lack of a better word, on either side. It's a more pleasant experience for everybody, and there's operational reliability. So one thing I can't stress enough is, even though this is something just starting, this is where the field is heading. So if you or your practice, if you get out in front of this, you will be much better off. And again, I want to thank you, and I especially want to really echo what Eric said, because I think that a lot of people don't hear this enough. Thank you for being here. Patients with disabilities really need you a lot. And, you know, we have great people like, for instance, you know, Dr. Wolf and Dean Oakley and folks like that, who really do a wonderful job keeping clinics open and going and available for patients with disabilities, and that's really important, but we really need more of you. So I cannot emphasize that enough. Thank you for everything that you are doing. It's really important, and particularly patients with disabilities really appreciate it. So thanks.